You're tuned into the Pulse Radio Show, brought to you with the kind compliments of MedSafe Medical Supplies. For all your medical supply needs, visit MedSafe Medical Supplies Limited. They offer a wide range of products, including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmitts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, they deliver free to the Queen Elizabeth Hospital. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Give them a call, 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
A pleasant good morning to all of our listeners here on Q100.7 FM. This is the QEH Pulse Radio Show. I am Shane Seeley, and it's good to be with you on this Monday morning. We had a bit of a break due to the passage of Hurricane Beryl. You know, we had a brush with that hurricane, and we know how the country is now rebuilding and picking up the pieces. Some of our neighbors didn't fare as well, and we could only pray that there is a speedy recovery for all who have been affected. We are in the Atlantic hurricane season, and we at the QEH, like the rest of our friends here in Barbados and across the region, have been in preparation mode as a result. We're expecting more systems to pass us this year, and yesterday, oh my goodness, yesterday was some serious rain, even more rain than we had during the passage of Hurricane Beryl, and that was just a tropical wave. The Met Office, they did send out a notice on Saturday. Of course, you never can predict the intensity that comes with some of these systems with any specificity. So some people were caught on the road in some heavy downpours, and we did see some breakdowns and such like, but we really hope that everyone understands now that we're in the hurricane season and we need to be prepared, and we're definitely doing that at the QEH, and we'll be talking a bit about that as we go through this morning. Of course, I'm Shane Seeley, your host for this morning's show, and along with me, my co-pilot, Dr. Christine Greenidge. Dr. Greenidge, how are you doing this morning?
I am well, and good morning to our listening public today, and hope that everybody is safe.
Yes, Dr. Greenidge, how did she's a Filipino, let me just say this, she makes no, she lets that be known. She is a true Filipino. I'm even more true Filipino than her, but that's a discussion for another time. And you mentioned, I remember speaking to you over that period during the passage of Hurricane Beryl, and you were talking about the winds and how they would have affected the neighborhood.
Yes. I am in the Long Bay development section in St. Philip, and it's literally on the coast, the northeast coast of St. Philip. And indeed, that wind was howling. It was really carrying on. The coconut trees and the palm trees were just bending to the wind, but nonetheless, you know, we came out okay. Everybody's safe, no loss of life, and that's what is so important.
So I mean, we always hear this, COO, God is a Bajan, and it continues to hold true. The fishing industry wasn't spared at all, and the Prime Minister has already announced plans to deal with that. But at our hospital, we've been in preparation mode for a couple months now.
Absolutely.
Really getting things ready.
It's a template that we have in terms of us being prepared. It's an ongoing assessment, ongoing process. Every year we go through our checklist to make sure that we look at things very important, medications, food, staff. It's a well-coordinated effort. And I must say that the team rose to the occasion in the last week and a half and made sure that fundamentally that our patients remain safe as well as our staff.
And that's what our focus is on. Patient-centered care. Every patient counts. Every staff member matters.
Yes.
And this is what our new CEO, who will be joining us shortly, Neil Clark, has been really promoting. So he's been getting down, what I would say, into the nitty-gritty of things. And he was at the plant, at the QEH facility, during the storm, to oversee operations, to ensure that
Absolutely.
everything ran smoothly. And then it was a coordinated effort because the executive team, yourself, leading the charge in charge of operations, it was one big coordinated effort, which really and truly was successful.
Absolutely. I think Mr. Clark is his first experience, and he wanted a hand-on, on-site approach. He was also joined by our Director of Medical Services, Mr. Anthony Harris, and the two of them went throughout the facility, checked on staff, checked on the physical plant. Later on, after the all clear, myself and the Director of Nursing Services, Mr. Pinder, we came in and piggyback upon Mr. Clark and Mr. Harris. So, in terms of hurricane preparedness, there are things that we did. One of the most important thing that we had to sit as a team and think about is to make sure that the public, those on medications, that they would have ample supply. And that was a determined strategy. We sent the notices out there, thank you, Shane, to let the public know we were extending our outpatient pharmacy hours. But the most important thing is that we targeted, if anyone had less than 7 days supply of medications, those were the patients and the ongoing patients on medication therapy that we targeted. So if we had less than a 7-day supply, we extended the hours over the weekend, Saturday and Sunday, and we beckoned folks to come in and get their medication filled. The other thing is that our home delivery service was very active as well. And I always want to plug the importance of the public taking advantage of home delivery service. It's an orchestrated, intentional delivery of medication at least 1 week before the supply of a 30-day supply is due to be expired.
Yes, and medication delivery, I just want to give you that number for those of you who haven't signed on to this amazing service. You can be at work and you have made that call to book your medication to come to you. You can be at home. They will deliver right to your doorstep. That number to call, 536-4804. It makes such a big difference. It saves you from coming into any congestion that you may meet in the hospital. We've been trying to decongest that pharmacy area through the medication delivery service to make it a lot more convenient for all of our patients. 536-4804. We're going to speak a bit more about the hurricane and the experience during that time, and that's why we have on the phone line our CEO Neil Clark. Neil, good morning. Welcome to the Pulse Radio Show. It's good to have you on. Before you get into the nitty-gritty about how you handled the storm at our hospital, I know the public will want to hear a bit about Neil and his experience in healthcare. I know you've done this a bit, but just for our listeners on the Pulse Radio Show, tell them a bit about who is Neil Clark.
Shane, thank you for inviting me onto the show. So, yes, a little bit about Neil. So, I've been working in healthcare for probably 30 years now. Started off working in private healthcare centres. I worked then in hospitals. I often worked in hospitals that were deemed to be failing hospitals, and do a lot of experience then to how we modernise these hospitals to deliver effective care and at the best way possible, delivering that. So I was involved in emergency care pathways, planned care pathways, and I have an extensive experience of hospital management. That was in the NHS in the UK. The last 10 years I've spent in the Middle East, in Abu Dhabi, where I worked on designing the healthcare system. And I was the director of healthcare planning for Abu Dhabi for 10 years. And that was, again, just making sure that the right services are in the right place and we have the right standards, the right quality requirements, and the right licensing requirements for the delivery of healthcare. I'm super excited now with my new role here at the Queen Elizabeth Hospital. I've been here for 3 months. And I'm looking forward to bringing some of the experience I've got from both the UK and the Middle East into Barbados.
So 3 months into the job and you've already experienced what was a Category 4 hurricane which brushed Barbados. Talk a bit about the experience in hospital now. being on the ground and commanding the troops?
Yeah, so I mean, even before the hurricane came, a lot of work was done in preparation for the hurricane. There's a team here, a team that was established to look at emergency preparedness, which included hurricanes and other emergency incidents. And that team formed some time back in preparation for the hurricane season. As Hurricane Beryl approached, those meetings became more regular as we put into place all the requirements that are needed to ensure the hospital can maintain its services throughout the hurricane. I was pleased and confident in the pre-planning that the team did. Obviously, they're much more experienced in hurricane management than I am, but seeing how they planned for the hurricane was both interesting and gave me assurance that they had good plans in place for dealing with the hurricane. I wanted to personally oversee how that went, and I attended the hospital on the Sunday morning before the hurricane just to see the final preparations, check off the checklist that we had of all the different things that needed to be done, and ensure that they were all in place and happening, and just meet the staff and say hello. I'm still doing my introduction to people for meeting the staff, and it was a good opportunity to meet many of the people as they prepared for the hurricane. As we went into the hurricane lockdown, I was walking around the different departments, again having the discussions with the staff and checking whether there was any concerns that they wanted to bring to my attention, both with the hurricane and generally with the hospital, because I'm new in the post. I was surprised at the resilience everybody had, the confidence that everybody had. I'm sure they obviously experienced, a number of them would have experienced hurricanes before, but they were a very strong team, and I was pleased to see they had a strong team who were dedicated to ensuring that the patients would remain safe and treated throughout that process. They work it by having a system where there's a team on site at the start of the hurricane to provide the treatment, with a second team also on site but resting to relieve the first team. And they're called Teams A and Teams B. And those teams will take throughout the period that will be within the hurricane, with a Team C at home on standby, ready to come in to provide that support as soon as the hurricane clears. So we had the team A was on started with the hurricane, and then there's a swap over, and Team B did the next day, and then at the end of the hurricane, Team C came in to relieve those staff. And in a similar way, I was on site along with the Director of Medical Services, Mr. Harris, as the executive lead on site, and then we got relieved by Christine, who's with you now, our Chief Operating Officer, and other members came in, and the Director of Nursing Services came in to follow up after the hurricane all clear had been given.
Well, generally no. That is a good overview of the hurricane, and a good opportunity to see how we operate going forward, because I know that we can now use this as a template in terms of our preparations for other storms, and even the weather event that we had over the weekend, which was quite sudden. Those are a bit harder to prepare for. What, for you, are some of the lessons learned from Hurricane Beryl?
So as soon as the hurricane finished, we reconvened a meeting of the emergency planning group, and we went through the team asking what did we learn, what could we improve, there's always room for improvement, and what would we need to make an amendment to the original hurricane checklist. We identified a number of areas of learning that we put into a plan, and what we'll be doing this week. Last week we identified those areas, and the teams went away to develop those plans, and this week they will just ensure those plans are now in place and brought into the next hurricane check sheet. We were fortunate, I suppose, that the hurricane just brushed by us. We had minor damage at the hospital, just minor damage, nothing significant. So we had leaks and a few panels blew off, but no significant damage. So in a sense, it was a good test for our plan, our initial plan, a good opportunity to refine that plan and make it stronger, and just a good overall ability for us to ensure that we have got the right things in place. So I was happy with the hurricane response. I'm happy with the review that's taken place since the hurricane, And I said next week we will finalise the plan that updates our checklist for the next set of things.
You're listening to the Pulse Radio Show with Shane Seeley, Dr. Christine Greenidge, our Chief Operations Officer, and Chief Executive Officer Neil Clark. Those numbers to call, 434-1007 or 434-1070. Remember, you can also WhatsApp us at 434-1007. So you have a number of options. Dr. Greenidge was in the chair of CEO before you came, Mr. Clark. I know she's spent roughly now 2 and some years here at the hospital.
2.5 years.
2.5 years. How time flies.
Yes.
And now the CEO already has had 3 months. Yes, the hurricane. What has it been like running the QEH generally? I think people would want to hear that. First, I'll let you go, CEO, and then let Dr. Greenidge go in terms of her experience handling all that comes with the QEH. And we have been in the media a lot recently too. So CEO, you take it away. How has it been at the helm of the QEH, generally?
So it's been an interesting start to my term here at the Queen Elizabeth Hospital. As you'll know, the hospital is a large organisation, 2,500 staff, 50 departments. We see about 13,000 inpatients a year, 110,000 outpatients, 26,000 patients go through the A&E department. We've got the diagnostics, doing about 45,000 diagnostics per year. We're probably dispensing in the region of 450,000 medicines per year. So it's a large and complex organisation, as hospitals are. When I come to any organisation, I want to have a quick check to see how are we doing. And to do that in a kind of structured approach, I look at 5 critical domains of a hospital. And the first one I'd look at would be service delivery. So how safe are the services that we provide? How effective are they? How caring are they? How responsive are they to patient needs? And how well led are they at all levels? And I'll go through those areas in my mind. I'm looking through the organisation, trying to get assurances and understanding of where we sit along that continuum of service delivery. In addition to that, I look at the infrastructure, the buildings and the equipment to ensure that the buildings and infrastructure is safe and secure and that we have a strong supply chain management systems in place. I also look at the workforce and how the workforce is operating, the staff engagement and the staff development and vacancies. I then look at financing. Let's understand how we get financed. Let's understand how we're managing against the budget. And the final thing I look at would be information management. So what systems do we have in relation to IT management and data available? I spend my first 2 months looking and listening and capturing as much information as I can on those 5 critical areas: service delivery, infrastructure building, workforce, financing, and information management. I meet as many people as I can. I understand their views and understandings of what's happening, and I try to triangulate that with available data to give me an understanding of what the current challenges are for the hospital.
Yeah, it's only fair. I was about to say it's fair that people will make their voices heard when they have challenges, and I know you have an open door policy, so they will come to you or send some correspondence to your office, and you respond to all of these that will come to your door. And as you've been here for 3 months, I think you need to be given that opportunity to respond to the challenges as they come. Before we go to you, COO, the CEO and COO, you may get a bit tongue-tied with both of them here. We have a caller on the line, so let's go to the phone lines. Good morning, caller. Welcome to the Pulse Radio Show. You have the CEO and COO here with me. How can we help?
Yes, hi, good morning, Shane. How are you doing?
We're good.
Oh, glad to hear that. That's wonderful. I have 2 questions for you this morning. Let me thank the production team for taking my call, and let me thank the QEH for going above and beyond board in terms of the care that they're giving to the community. And my first question is for the COO. Good morning, Dr. Greenidge.
Good morning.
Yes, ma'am. I know that you would have been a nurse before, and I just wanted to know what are your plans for the new resource coming to the hospital in terms of being more prepared for even as there is a new field, new styles like these for the nursing practitioners that are going to come back to give more bite to the bark of the hospital in terms of its care to this country. Thank you. And I have another question. I finish, please. Thank you.
Yes, that's a great question, and thank you for recognizing my profession of registered nurse.
Yes, thank you very much indeed.
Yes. I'm not sure if you saw the program last night by the president of the Barbados Nurses Association, Dr. Faye Paris.
Yes.
And she did a wonderful job in sharing with the public the goals and the ambitions for professional nursing in Barbados. And in particular, I just want to say that we have great support at the level of the government here in our Prime Minister to look at advanced nursing practice. Advanced nursing practice consists of 3 different higher level professional nursing practices. One is nurse practitioner, the second is clinical nurse specialist, and the third is one that is not commonly known, and that is a certified registered nurse anesthetist. And these are nurses that are trained to provide anesthesia at different levels in surgical procedures. So I look forward to it. I have met with BNA several times. I've met with Dr. Paris. I was joined at a meeting that the Prime Minister held, and I am very excited about where nursing practice ought to be in 2024 and beyond. So internally at the QEH, we are now looking at, there's one skill set that fundamentally is very important. So we're training our nurses right now to provide phlebotomy. That means to start IVs, to do venipuncture, and just having that skill will help our physician counterparts in some of the things that right now that they're charged to do. So it's really assessing where the current level of practice is. We need the Nursing Council to look really astutely in terms of support and advancing professional nursing practice, because we know at the level of nurse practitioners, of CNS and CRNAs, they can be assigned a whole caseload of patients to help out in more in outpatients, but as well as in acute care in the A&E, for example. So yes, I'm excited at where nursing is. I think BNA has a very strong leader and full support of myself as a registered nurse, and I'll be keeping my pulse, literally my pulse, on the advancement of practice. How do you like that?
Well done. Thanks very much. I really appreciate that. That was a brilliant answer. Fantastic answer. Out of this world. And my next question is for the CEO in terms of out of this world, in terms of the World Cup that was just finished, and you would have opened your, good morning to you, sir. You would have opened your facility to the public in terms of, and to the tourists, especially in terms of that facility, that Harrison's Point, and they would have gone there. And let me thank you so much for giving me that care. I'm asking, what is going to be done now with that facility? Is it going to be closed down, or are you going to continue to use or use it for a different function in terms of the facilities at Harrison's Point for the care of the public and the tourists as well, if that's going to be done now? Thank you.
Yes, good morning, and thank you for your question.
Yes, thank you very much.
It was recommissioned for T20, but also for the hurricane season. So we're very fortunate that we have a large facility at the north of the island, which is equipped for about 20 critical care beds and about 200 standard beds. So we will continue to keep the hospital equipped with those beds. Should we ever need there'll be another hurricane and we need to create more space in the acute hospital, the plan would be that we would transfer less acute patients up into the Harrison Point area. And it's also used to keep our a stock of supplies of medications and consumables, rather than having, as you could say, maybe all the eggs in one basket at the Queen Elizabeth Hospital. We have some supplies and consumables at the Queen Elizabeth Hospital and some supplies and consumables over at Harrison Point. So for the remainder of the hurricane season, we will keep the facility prepared on standby if it ever be needed for an emergency event. We've got additional beds available up at the Harrison Point site.
Well, thank you very much, CEO, for answering that question. And it's good that we continue that operation there, especially during the hurricane season. We don't know what it will bring, but so far it's not looking good in terms of the intensity of what we are seeing. COO, you had your chance. to run the QEH. As the CEO has seen a number of challenges coming his way, so have you in roughly 2 years. What is your take on how the QEH is perceived and your operation in charge?
I first of all, I played that role along with my COO role for 9 months before Neil joined us as a team. But fundamentally, any success at leadership levels comes from support from your immediate leadership staff as well as the grassroots people. And I must say, I got that support. I also got tremendous support from our Senior Minister of Health, Minister Jerome Walcott, and at the time, Minister Sonia Brown, who was assigned to the QEH. So that support was fundamentally important to me. It was a long 9 months. I didn't have the COO. I was in dual role. But nonetheless, the focus always has to be the patient experience, right? So the many stories that I've heard and the many questions from the public is where upon your arrival, I use you and your capacity as our communication specialist to get the word out there, to tell the public about the wonderful services at the Queen Elizabeth Hospital, the wonderful workforce who come to work every day, fully committed to do the best that they can, despite the many, many challenges. Healthcare is not stagnant. Healthcare moves in nanoseconds, and therefore we have a public that's very demanded, and rightfully so, and we are charged as healthcare providers to provide the quality services that everyone deserves. Mm-hmm. So it was very interesting. I've learned a lot and continue to learn, but I want to say that fundamentally patient care and that patient experience was at the core of everything that I did and will continue to do.
And both you and Mr. Clark have done an awesome job so far, in my opinion, and this is being shared by one of our WhatsApp listeners. Good morning. Just want to compliment you guys on the awesome services you provide. The medication delivery service is exemplary. Never had a problem with it. Was using it for a year now. Thank you, Vivian, for your comment. Vivian Foster there, chiming into the Pulse radio show right here on Q100.7 FM CBC Radio. Let's go back to the phone lines. We have another caller. Good morning, caller.
Yeah.
Welcome to the program. What's your question or comment?
Yeah, good morning. This question is to the CEO. When will you all go about? It's a big question. I don't know if I should ask it here, but I'm doing it. When you all going to go about trusting for people to credit them, like suppose you want to have a operation for your eyes or some parts and you got to come in and you plan to pay down like some money like how it used to do years ago and pay the rest, but you know that do not go on no more. So then you all would learn to trust back certain people that we would have got proof that they will pay the rest of the money and stick to the plan. Hello? I got you there, huh? I want
the
to
CEO?
know.
Oh, he said COO, but CEO, if you want to take it.
Whichever one that about there that own the hospital, like the CEO or yours.
No, they run the hospital with your taxpayers' money.
Yeah.
And of course, they're here to answer your question. CEO?
Yeah, you raised an important question about how we manage patients through the system. And I'm really keen that I get deeper involved in understanding how we're scheduling patients for the operations, outpatients and inpatients, how we're scheduling the patients, how many patients are waiting for their treatment and how long they're waiting. So I'm trying to work now through about what I call a balanced scorecard to give me a good feel as to how the service is operating as it is today. So we can identify where there's waiting lists that are too long, where there's waiting lists that are growing, and then we can be clear where we need to put the effort into resolving those. Ideally, we should be working on bringing all the waiting lists down. And there's work to be done on even capturing the data to bring those waiting lists down. And one of the things...
Hello, stick a pen there. I want to know, like, someone come in and agree, like, to pay half of the money or three parts. Remember when you were not there, when that supposed to be done. And then I make a rest, but I get to understand that is not happening no more. Or the a lot of people fall away from keeping their agreement. So my question is, when are we going to go about build up that trust that you will get some, like, okay, I bring papers if it is me or somebody else to prove, even if it's papers for your house, your land, something or something, or your pension check or something, that you will know, yes, I can get my money, so you could go on and have the operation. You understand what I'm saying? See,
Yes, I will respond, and thank you so much for that concern. And I just want to emphasize that on a personal one-to-one basis, you can come in, our Director of Financial Services, Mr. Hurley, as well as our staff in the Corporate Business Unit, will work with you individually to settle any aftercare costs reasonably with you. We have done this. I know in my time here, I've seen folks pay down, and that is still the practice. And is based on one-on-one. And I hear your plea, and absolutely, we have to be reasonable. We must be reasonable, and that those terms can always be worked out. So I want to assure you that the service is still very much there for you and others.
Right, but that's why I want concern, because I asked about it, and they were saying that because so much people, which I know and I heard, like any news, which wherever you go with that, right? Yes, people came in and and then they did not return to pay them bills.
Yes.
But I know that it made it bad for others that are willing. So
yes,
that's why I put that point, that if it going back happening, then that you will bring like some sort of assure security if something could happen.
Yes. So let me just emphasize, towards the end of last year, we had a 6-month, almost not quite 100% amnesty, but we were encouraging people who might have had any loans or any outstanding monies due. We gave a grace period that went beyond the original 3-4 months. We went to the end of the year, and people came in to settle some of their debts, and yes, others did not. But the thing is that when we don't have these monies collected, it really takes away from our ability to provide some services. Some services.
Somebody else.
Yes, correct.
Right. So So that's what I'm trying to get straight to know, if that it going back happening or something, so that like somebody like me or anybody else could come in and go to wherever place is, bring some serious documents or whatever, that when I get with the money. Or I done got some people like me out here still like to see zeros no matter what, or our bills when we do them. As one of them copy we verify for bakes, well last week bakes, or
I hear you.
You like them? You like bakes?
Yes.
You sure you like bakes? You want the eggs in them?
I raised up with my grandmother on bakes. But the thing is that my bakes had a little bit of cornmeal as a child.
Oh, dear.
I don't know. They do flour now. What happened to the cornmeal? But let me just say, caller, I appreciate your call, and I think that we have some food for thought to look back again to see what we can do. Perhaps do another campaign to encourage people to come in and pay off their debt. So I appreciate this, and I'm going to run with your idea.
Right. So that's why I'm saying that if I come in, I just want debt. My debt says 0, so I want enough more out there like me, but we get juked pretty small. I've been through others that did not keep up their
end of the bargain.
So that's what got me in trouble. So that's all I want to know. No, you understand?
Yeah.
Yes.
So you see, you don't have us. You didn't catch us.
No.
We thank you for your call.
Great idea.
We thank you for giving us some food for thought, so that we can probably announce another amnesty. Of course, it has to go through the channels, and the CEO will have to sign off on it. But it is an opportunity for not only us to recoup some funds, but for the public to do what they need to do and get the care that they need to. If they have had it already, they know what they would have received, the good care from our medical teams and our ancillary staff, and they want to pay. We're willing for them to come in and just work out that payment plan. So thank you, caller, for that comment. We have another message coming in on WhatsApp about the medication delivery service. I use the medication hotline to receive my medication monthly from the QEH. I usually call when I'm about 1 week in to renew. My issue is I have to call 3 or 4 days to make contact with someone. Last month, I actually had to ration my medication so as to not run out over the weekend. It is very difficult to get someone to answer the phone or to call back if you leave a message. Better needs to be done. And you're right. I'm glad that you're leaving a message, and that is one of the things that we always advocate for people to leave messages, because we know that our staff will get back to you in a timely manner so that you can get your medication. But we thank you for that observation, for that complaint. It's something that we can respond to going forward through our medication delivery service. You're listening to the QEH Pulse Radio Show. This is episode 5 with our CEO, Neil Clark, Dr. Christine Greenidge, our Chief Operations Officer, and me, Shane Seeley, Communications Specialist. We'll take a break, and we'll be right back.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. They offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmitts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, they deliver free to the Queen Elizabeth Hospital. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Give them a call, 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back on with you here on the Pulse Radio Show. Shane Seeley, Dr. Christine Greenidge, Chief Operations Officer, and our CEO, Chief Executive Officer, Neil Clark. It's always good to be with you every Monday morning from 11 to 12 to hear your questions, to hear your concerns, so that we can respond. It's all about our outreach as we continue to celebrate 60 years at the QEH. This is our 60th anniversary year, and the official date is November the 14th. So we're close to independence, and we're going to be celebrating in a big way leading up to that big day, and we'll keep you informed right here on the Pulse Radio Show. We've been doing a review on our operations during the passage of Hurricane Beryl. You've heard the CEO talk about those lessons learned and what we are going to do to improve and enhance our operations, especially during the passage of those storms. But there is a bigger vision that the CEO has brought on board for the Queen Elizabeth Hospital, and a number of things that he has set in motion to action which will improve the service that the Queen Elizabeth Hospital offers to the public across the board. CEO, I'd like you to go into a bit of those enhancements that you have planned for the hospital, and specifically some of those projects that you have your hands on, that you're spearheading, that you know that once they are in train, once they are operational, can really seek to improve what we are doing there.
Thank you, Shane. Yes, thank you. So I mentioned earlier on about 5 critical domains that I look at to improve. And then once I've got those domains in mind, what we start to build then is the capability and the culture in the organisation to enable change to happen and to ensure we're providing a safe service for all our patients. One of the things that we've already started to produce is what's called a governance framework. This outlines who does what, and it's really important that we have clarity in a large organisation of who's responsible for delivering what. And that document identifies the role of different boards and committees and the directors within the hospital too, as well as the chairman and myself, the chief executive. A balanced scorecard is being produced, which then gives me a feel for how we're running on a day-by-day view, how we're running. And then what I need to then look at is the strategy review. So I've reviewed the old strategy, looking to develop a new strategy, and how we can develop that strategy along with the public and with the staff here in the organisation, so we understand exactly where we are now and where we want to be in the next 3 years from now. One of the important things to enable us to make changes, though, is leadership and culture. We need to make sure that we have the skills to deliver. And that's about change management, about committing to change, and about the capacity and the mindset and the belief that we can make those changes. And I guess maybe when I've met some people here, there's a frustration that some changes that they've wanted to happen haven't moved forward or haven't moved forward fast enough. And we have to build the belief that as a team, and we are a team, that we can make those changes. I'm all about making the changes with the team. Those individuals on the front line, be those in the engineering department or be those in the laboratories, they know what's best for them. And they should be feeding into our strategy as to how we're going to move forward over the next few years. But they also need to be leading themselves on how we make those changes. It's really important that I get the leadership and the skills in place to enable us to do that. It's also really important that we communicate. We communicate with staff internally, and we communicate with the public about what we're doing. And I know Shane's been doing a great job for us making this happen and bringing about how we are enhancing our communication so everybody understands where we're up to on doing that. In relation to some specific projects, obviously you've probably heard me already say that I want us to move into being a digitized hospital. We need to move to have a health information system which enables doctors at all points in the system to be able to see immediately the medical records and allow outpatient staff, when they're receiving phone calls, to immediately be able to log in and see what's happening with an individual patient and provide the data and the information at real time as to what's happening in the hospital. So we're progressing at speed on trying to commission a health information system and putting the structures around that to enable that to come in. So that's one of the things that we're working on at speed. We've had the great opportunity, because Christine's been here for some time, and an experienced nurse and chief operating officer. So what we've been able to do, as Christine said, she was doing two jobs at once, which is a real challenge for her. What we've been able to do now is focus Christine on the clinical operations within the hospital. And some of the things that we will be looking at improving further then will be a review of the A&E patient flow, a review of the medical bed optimization. And we've already had discussions with some of the clinical leads in these areas about how we can further improve those particular areas. Another thing that I'm really keen that we do is how we get better staff engagement and how the staff feel that they're appreciated and that they can contribute into delivering the changes that we need going forward. I'm really keen that we do improve the unplanned care services, the emergency care pathway, so patients have a better experience with less delays. I'm really keen that we do similar for the planned pathway, those who are coming in for outpatient procedures, outpatient appointments and inpatients. And I'm also really keen that we review the oncology pathway so we can see what's happening with the cancer patients and ensuring that they're getting optimal treatments. In fact, to support the oncology pathway, we will be bringing in a new linear accelerator, which will provide treatments for the cancer patients, and that's online to come in towards the end of this year.
People, I know that the audience will be really happy to hear that. As far as oncology is concerned, we've been doing a lot of treatment, but it has mainly been on the palliative side, and we've been sending patients overseas to Colombia for treatment, COO.
Yes, absolutely. And from the clinical side of what Neil just shared in terms of patient care services at all specialties, for example, the oncology patient population, right now we have a cobalt system of palliative care for patients who have cancer. The linear accelerator, I just want to take one moment to explain to the public the advantages of having a LINAC system. And the radiation therapy that's delivered by a linear accelerator is specifically target the cancer cells, the tumor cells. But most importantly, unlike cobalt, the tissues or the cells around that tumor are not affected by that beam of radiation. So it is much more targeted for the cells, to destruct the cells, and also at the same time preserve the healthy tissues that may be around tumors.
Wow.
So right now our patients are receiving this therapy out of the country, specifically in Colombia, but we also are looking at different countries so that we can accelerate those patients that are awaiting that particular type of cancer care. I want to also mention the NCDs are not going away. In particular, diabetes control, in particular cardiovascular illnesses, heart disease, and the whole gamut that our patient population, unfortunately, because of COVID, a lot of those states or those healthy states have become unhealthy states. So we need to look at self-care management. I love to do education, Shane. You know that is part of my passion, to educate the public. We have to take some control of self-care management. We at the QEH and our providers in health in general, we have a part to play, and a big part of it is to educate our public more about medication compliance, about dietary compliance, about weight compliance, about activity compliance. Those 4 things can make the world of difference in
You ready
living.
to talk about the plate of food?
The plate of food. I talk about the plate of food that's piled high in the air. So the plate is full and the height of it is full, and
Full of carbs too.
and full of carbs. And I have this story I share in my church
That's right.
in New York, when we have these wonderful church luncheons, and they're wonderful. I put all the vegetables and the salads up front, so that as people are on that line, they take the healthy stuff first. When they get to the rice and the macaroni pie, that's way down the back. But here it's flipped. So those things are up front. And when we get to the end of the buffet line, there's the salad and all the great things. So,
And no space for it.
Yes.
I know that, and I mentioned that purposely because these are some of the topics that we will be touching on going forward, especially in dealing with and controlling chronic non-communicable diseases. There's a heavy burden being placed on the Queen Elizabeth Hospital because of non-compliance, and that is why that information that we sent out about people, extending those hours for the medication delivery service so that people can come and get their medication, was so important for us and so important for patients as well. Because if you are without that medication to manage your condition for any period of time, then you would end up where we don't want you to end up, which is possibly accident and emergency. And we really want you to be more proactive in managing and dealing with your health. And that's why this radio show is so important for us, so that we can reach you with that information. And there's a lot more information on that to come. You're listening to the Pulse Radio Show with me, Shane Seeley, our CEO, Neil Clark, and Dr. Christine Greenidge, our Chief Operations Officer. Again, those numbers to call, we have a few more minutes. 434-1007, 434-1070, and we have had those WhatsApp messages coming to us through 434-1007. So yes, we are here and available to take those calls. CEO, back to that vision. There are a couple other projects that we know that are in the pipeline. Well, I should say that I know that that are in the pipeline. Maybe that you would want to touch on in terms of improving our level of care. You touched on the LINACs, the linear accelerator, which is coming, and that is great news for those oncology patients who have been waiting. Also, you would have touched on what we are doing in terms of improving our medical records keeping and response, because once we get that system up and running, patients will be able to call and we'll just be able to pull out that information, and it goes even further because they will have the ability to pull up their own information from their mobile devices or from their desktops, laptops, or what have you. So that is great news. What else would you want to see us doing in the next 2 to 3 years, or I should say between 1 and 3 years, as we try to advance patient care and make patient care priority at the hospital?
So it's really about understanding patient flow. And what I really want to get into is the detail of how the patients flow through the hospitals and where are the blockages. Nobody should be waiting for anything for any longer than what they need to. And with the new information system, we'll be able to easily identify where these blockages are and put our time and effort into addressing those. What I often see is when we look at cause and effect, often we're fixing the effect of something that's gone wrong. And we're not necessarily identifying the cause and fixing the cause. And I really want us to understand what creates delays in patient treatment. and what can we do, therefore, to address those delays. And I've done a lot of work in the past in understanding how a patient flows through the organisation and how the medical records flow through the organisation with them. And I'll be working with the team so we can get a real clear understanding of what it is we can do to reduce those delays. And then at the same time, I want to make sure that we're providing as safe a service as possible of how we're benchmarking our outcomes against international best practice and standards. So you can get safe services as quickly as possible. Now, all of this, of course, will take some time. The health information system will assist us with identifying on the data side, but the management and the development of the teams and the staff, giving the staff the ability to manage their own departments and make their own suggestions as to how they can improve each of their departments, is something that I'm keen for us to explore. I've already invited a number of the clinical leads to come and speak to the executive directors about their plans for their own departments, so they can share with us what it is that they want to do and how they plan to do that, and then we can discuss how we can support them and taking those forward. So I really want to focus, over the next 2 or 3 years on making sure that our clinical outcomes are as good as they can be, in line with international best practice, and patients aren't waiting any longer than what they need to do. I also want to build confidence, and by that I want to build confidence with the staff and with the patients to identify when we're not getting it right, because there will be times when we don't get it right, and nobody should be afraid of saying something's wrong here and calling that out, because I always say, if I don't hear it, I might not know it. And so I always encourage all patients and all staff members to raise issues that are of concern with myself or with their line managers and managers, so we can tackle those and we can address those. I think maybe sometimes people are not raising the complaints because they see that as being negative. I don't see that as being negative. Any patient experience I want to hear about, be that good experience or bad experience, so we can tackle when they've had a bad experience and we can inform the staff when they've provided patients with good experience. So again, I keep saying, if you have anything to share with us, please keep communicating with us.
Yes, indeed. Yes, indeed. Agreed, CEO. And I know the CEO would concur, because I think what this radio show has allowed us to do is be here to answer the tough questions. There will be tough questions because it is the Queen Elizabeth Hospital, which the entire population depends on. So once we keep connecting, not only with QEH Connect, which is our website, but generally with the public, we will be able to not only respond to those issues and concerns, but rise to the challenges and ensure that we are able to respond to the population's needs.
Yes, I think you used one word that I want to piggyback on, connect. So QEH is not, we're a single entity, but we're part of the bigger healthcare sector. So we need to connect, and we need to connect with our polyclinics. We need to connect with our community-based healthcare organizations. We need to connect with the people outside of QEH that we want to keep healthy. So our medical practitioners, our nursing councils, it's all one connection, so that the patient becomes the recipient of that quality care that extends beyond. Part of our connection is in public health. We want to make sure that the public health sector is strong enough to keep patients from coming in to the hospitals. So we take care of it while they're here, but of course, the continuity of care in the greater society is very, very important. So we must connect, we the QH, we have to connect with everyone that is providing healthcare services on the outside as well.
And let me connect.
I'd just like to add also.
Go ahead, CEO.
I'd just like to add also, a caller has left a message about the medication delivery system and the calls not being responded to or not being answered. Now, that's something that I wasn't aware of. Now, hearing that allows us to go and investigate that and identify what's the challenge and put that into place. So it's great to hear these things, because we can go and investigate them and take a look at them. And we've also got to get better as a QEH at responding. When somebody does raise something, we've got to respond and make sure they know that we're tackling their concerns and how we're doing it and how we're moving that forward. And that's something else that I want to see through is how well we respond when somebody communicates with us, that we respond and we listen and we provide a response which gives the evidence that we've heard and that we're going to tackle and improve the situation going forward.
Yes. I know that we have been in the media a lot recently, and they probably would say I wouldn't be a good former journalist if I didn't ask you this. We had that media report about the lab and their complaints, and this is just an example to how you answer, how you hear about the complaints so you can respond, because you heard about those complaints like the rest of the nation did on Friday. So let's talk about that. You know, you're hearing the complaint because every patient matters, every staff member counts, and we've listened to them. How do we respond in a manner like this? Or what is your advice in terms of how we operate like this going forward?
So you're raising a good point. So on Friday, I received an email from the lab team expressing some concern. I immediately responded. Because I like to hear, I'm collecting the information, I like to hear the concerns so we can work out how we can address those concerns. I immediately responded and arranged a meeting I had with them this morning. So I met with the lab team this morning, along with a number of the other directors, to hear their concerns. And it was good for me to hear them firsthand, because whilst I was aware of some of the concerns, I've done a walkthrough the lab department. The facility is tired. It is a tired facility. It has got a number of challenges within the facility for the lab team. I wanted to hear it direct from the staff. So the staff told me today of their particular concerns in relation to the lab. And we've worked through with them today what their priority concerns are. And now what I need to do is go away and identify how can we address those concerns. Along with the staff, together, how can we address those concerns? They've raised them. That's a challenge for us, and now we have to work out how we can best address those. And that's what we'll be focusing on over the next week, so we can work out how can we provide support to our staff who are raising genuine concerns.
And that's how we operate at the QEH. I think that is the modus operandi going forward. If you have concerns, you raise them, we hear them, and we respond in a timely manner. We address those concerns so that everyone involved is happy at the end of the day. Any final words from you, COO?
Yes, I just want to say that it's all about teams and teamwork together.
Makes the dream work.
And it makes the dream work. And my personal mantra is the patient's experience is our reality, our staff's reality. So whatever that patient perceives, we are bounded to respond to as quickly as we can. But encouraging staff to speak up is very, very important. I think Neil made a very good point. Unless you know something, you can't really respond. But that meeting was a very constructive meeting, and the staff got the opportunity to share with Mr. Clark, their priorities. And I'm sure Neil is very action oriented, and there will be a plan in place to deal with the major prioritized area of concerns, not only in the lab, but any other department that has relayed such concerns.
The lab are a very important cog in the wheel, and they're a very important team partner, team member with Team QEH. That's what we all are, Team QEH, from the CEO right down to every member of staff. We are Team QEH, and we are going to respond not only to the concerns of the public, not only to the concerns of our visitors, but our staff as well, and make that a priority. Well, that's our time for this edition, the 5th episode of the Pulse Radio Show. I'm Shane Seeley. Of course, I've been joined by my co-host, Dr. Christine Greenidge, our Chief Operations Officer, and our Chief Executive Officer, Neil Clark. We'll see you next week. We are going to talk about the EAS. We'll have the ambulance service in to talk about how they respond to your needs on a daily basis. Until then, we'll see you next time.
The QEH Pulse radio show heard right here on Q100.7 FM and brought to you with the kind compliments of MedSafe Medical Supplies Limited. For all your medical supply needs, visit MedSafe Medical Supplies Limited. They offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmitts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, they deliver free to the Queen Elizabeth Hospital. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Give them a call, 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.